Your host, Meg, is a mom on a mission, clean living advocate, and firm believer that small choices create big change. Some might call her passionate. She calls it unapologetic. Around here, we talk about real wellness, not perfection, not what the industry sells us, just honest conversations, practical swaps, personal stories, and everyday ways to take back control of your health, one choice at a time. If you're ready to live more intentionally, think differently, and raise your standards for what you allow in your life and your home, you're in the right place. Reminder, this podcast is for informational purposes only and should not be considered medical advice. Always consult with your doctor or qualified health professional for questions about your health. So let's get into it.
Thank you for joining and welcome to Unapologetically Meg. I have Dr. Toni Engram in the house today. Thank you, Dr. Toni, for joining. Dr. Toni is a biological dentist, integrative health coach, and owner of Flourish Dental Boutique in Richardson, Texas, and the only dentist that my kids have ever been to and love. So it's funny. Maeve just this past week was like, when's my next dental appointment?
Oh, I love it.
Yeah, so they love coming. So thank you. So I want to kick it off essentially with your journey. So I know you started down the traditional path, and I think you called it the woohoo biological side. So moving over to the other side that you never thought that would be your path. And I think it was health and autoimmune issues that sort of guided you in that direction. So make the connection there for me.
Yeah. So like you said, I really just wanted to be a normal dentist and do normal things. I just want to be a normal girl. But thankfully God had other plans for me and for my career. So it was in 2011, I was working as an associate dentist. So I was working full time. I had a toddler at home and I was in the midst of opening my first practice. So just really burning the candle at both ends. Yeah. And that was more than my body could handle. I got super sick, was having all kinds of gut digestive fun issues that we don't have to talk about unless you just want to talk about.
That's okay. We'll save it for another day.
Was finally got a diagnosis of Crohn's disease. And what the gastroenterologist told me was a very standard Western medicine answer to that particular diagnosis. He said, here's your list of medications. You're going to be on these forever or until they stop working and we have to put you on stronger medications. Right. And oh, by the way, there's at least a 40% chance that you're going to need surgery at some point to lose all or part of your colon. I was 30 years old. I had things going on. I didn't have time for this. And so I asked, I was like, well, what do I need to be eating? What do I need to do to get rid of this? And he said, Toni, your diet has nothing to do with this. The autoimmune, I know, right? The autoimmune condition that was tearing up my gut. He said my food had nothing to do with it. So thankfully I'm a little bit stubborn and that set off alarm bells and all kinds of red flags in me. And I just wasn't buying the answer. So I went on the journey to try to figure out how to get myself well. And along the way, I learned a ton. I learned things that worked for me, things that didn't. I learned that there's no one size fits all to getting well. But what was really interesting to me was that Crohn's disease, it's an autoimmune condition, but it's an inflammatory condition. Right. It's all about inflammation from this dysbiosis, this imbalanced bacteria in the gut. And the more I learned, the more I was like, wait a minute, I'm a dentist and I treat tooth decay and gum disease all day, every day. That's all about inflammation, right. Dysbiosis in the very first part of your gut, which is your mouth. And so as I started to feel better and learn what actually did work for me, and thankfully did heal and have been in remission for over a decade, what I decided was that I was just a hypocrite if I didn't figure out how to do the same thing for my patients that I was doing for myself.
Oh, interesting.
So I had to, as I learned to get myself well, then I said, okay, how do I do this for mouths? How do I do this for my patients?
You went down the rabbit hole, right?
I went down the rabbit hole. I know. And once you go in,
once you
can't
go,
check out.
there's no stopping.
So that's what led me to biological dentistry. I kind of tiptoed my way in, and then my patients helped nudge me the rest of the way. They would say, this nutrition stuff is great, Dr. Engram, but what are you doing with fluoride? Like, what are you doing?
Yeah, we'll get there. I love it. Okay. So what is the difference between biological dentistry and traditional? So for me, having gone down the rabbit hole when I, lost my parents both to cancer, you just sort of keep spiraling. And so I knew that I didn't want to go anywhere that offered up crust, that had me do, the fluoride wash, but I know it's obviously more than that. So how would you describe the difference between your approach and a traditional?
So let's start super high level, the super high, and then I'll tell you like what that actually means in real life. So the super high level is that we use the principles of biological medicine, which goes beyond, Western medicine uses the germ theory of disease. One germ causes one illness. And so one substance or medication can therefore cure one illness. Biological medicine goes beyond that, and we look at the terrain theory of disease. So we want to see how can we optimize the health of the entire body, of the biological terrain, so that we are optimized to prevent illness and to achieve healing. So it doesn't mean the germ theory is not true also, but we have to have a healthy terrain. So what that means is that we are trying to eliminate oral contributors to systemic illness. So we're looking for infections, not just because they can impact your teeth, because infections can actually impact your entire body. They can impact the terrain. We are looking to have fewer toxic materials that we're putting into your mouth. So like you said, no fluoride. We try not to use the icky stuff, but every single material we use, we're very intentional with what can we use that's still really effective, but has maybe a better safety profile than what we're used to using.
So like, what's one example in terms of that?
Aside from fluoride, the easy example is mercury, the old silver fillings that were 50% mercury. And so not only are we not using them, but also you're going to get a huge exposure to mercury in the entire room of a procedure when you touch them. So when we have to replace those fillings for one reason or another, we use really specific protocols to make sure that the patient is protected, that I'm protected, that my assistant is protected, that we're filtering that junk out, because you really do have a mercury exposure that OSHA would not be happy about if they were to come and measure during those appointments.
Do you find a lot of people still have mercury fillings?
Oh, yeah.
Really?
Yeah. Oh, everybody my age and older.
Oh my gosh. So when they come in, is that, hey, we need to talk about this approach of
So I always mention it. It's really all about informed consent. Most of my patients now seek me out because we have shared values. So they seek me out because they are already uncomfortable with either the root canals or the amalgam fillings that have mercury. It's already on their radar. If they come to me and it's not on their radar, then yeah, we'll talk about it. We'll say, hey, these old silver fillings that you got when you were a kid, they are half mercury. You are and have been having the tiny little exposure every time you eat, every time you chew, you grind your teeth, you brush your teeth. Heat and friction will release mercury vapor. Most people can handle that exposure just fine, but when it's time, and we can talk about with each patient in each case when it's time and when it makes sense, or when it's necessary to replace them, then we talk about the protocols that we have in place. Yeah.
Interesting. Okay. You had mentioned root canals.
Mm-hmm.
So I will say that it became eye-opening to me when I watched the Root Cause documentary on Netflix, which they no longer have on there. But how much truth was in that documentary?
Quite a bit. I mean, I think like any good documentary film, it's a piece of art. And so I think it's important to know that context is important. And in a documentary, you're not always going to get all of the context.
Sure.
That's not what it's for. A documentary is meant to evoke emotion, to make you.
It did.
And it absolutely did.
Yeah.
So I love it because it started the conversation with so many more people that hadn't thought of this before. Were there some things that were maybe taken out of context? Yeah, I think there were. And I think it's unfortunate if some people left with the idea that it was fear mongering or anything like that. But it's still, I love the fact that it started the conversations.
Right.
And there was really some excellent information and some excellent experts in our field that were interviewed for the documentary.
So you don't do them, or is there a time or place where you might?
I personally don't do them. They do take some extra skill. And I think they are best done with a microscope. And so there are a lot of reasons where if you're going to have a root canal, I do not judge. It's all about your choice. I believe in informed consent and bodily autonomy. And so we talk about the pros and cons. And if it makes sense for a patient to have a root canal, then I want it to be the best root canal possible. And that means not in my hands.
Gotcha.
It means in the hands of a specialist. And we have a group that we refer to that's a little more holistically minded. They use ozone in their treatments.
Right.
They have a microscope and they do just a fantastic job.
So for those that have had a root canal, is there something that they should do for prevention? Because the whole premise, I guess, with the documentary was how much it opened your world to more diseases and illness. So is there something that they can do now?
There are always things that you can do. I would say, for one, we want to keep a close eye on those root canals. So I really like doing what's called a cone beam CT. It's that 3D scan that we take so we can see the root canal better than on a normal x-ray. I want to be able to see it in 3D so that we can see, is there a hint of infection that's left that we can see, or recurring infection, because that's a common issue with root canals. And some would argue that's the issue with root canals, is the inability to get 100% disinfection of the entire root canal system within a tooth. And that's what tips the scales in favor of disease sometimes in some people, again, if their terrain is not healthy. So if we want to talk about prevention, you've got a root canal or 2 or 3, and you want to know what to do about it to make sure for one, know that it's there, get it checked frequently. Ideally have a biological dentist that's looking at it, or a dentist that has a 3D scan that can look at it. I think it's important that we have an overall healthy diet, healthy lifestyle. We work on inflammation. And those are really the things that we can do to make sure that we're preventing any issues from happening.
So the gut health, when you're talking a lot about the terrain, kind of that gut health. Yep.
Huge.
Yep. Okay. Fluoride. Obviously, my traditional dentists and friends that are in that realm, like, live and breathe by fluoride and are all in. So what really are the pros and cons behind it?
So fluoride is a good tool that was discovered that can reduce the rate of tooth decay by like 40%. Like it's significant. So it can be a significant tool to fight tooth decay. How it works is it will get incorporated into the tooth structure. It will replace some of the calcium ions with fluoride ions. And so your tooth structure, your tooth enamel, goes from being made up of primarily calcium hydroxyapatite, that crystalline structure, to being made up of fluorapatite crystals. So, and the fluorapatite crystals are slightly harder. They are more resistant to acid. So fluoride is a great tool. However, the however is where my colleagues and I often disagree. The more we look at the risk level is not what I was taught in dental school. The more research that's being done, especially in other countries where maybe there's less political sway one direction or the other, is really showing that no, fluoride exposure actually is implicated and is correlated with things like lower IQ in our kids. Like, holy smokes. That was when I was in dental school, they would talk bad about, obviously, the holistic dentists. And those were the people who were like the tinfoil hat people. Yeah. Who believed that the government was introducing fluoride to dumb down the population. Yep. That was the conspiracy theory. Well, holy crap. Yep. It turns out fluoride reduces IQ in our children, especially our boys. So if you wind up, and we're talking like significant, like up to a 10-point IQ drop, which can make the difference if you've got a kid who's on the verge of needing help in school and their IQ is 10 points lower than it would have been naturally. Now you're talking about this massive impact on society as a whole, where I think we really need to start questioning it. Why are we still administering this in the water?
I was just going to ask, that's still part of our water system, right? Yes.
Mm-hmm. Yeah, not everywhere. It's still a local decision. For the most part, a couple of states now, just recently, a couple of states have said we're going to make it a state issue that it's no longer in the water. Okay. But for the most part, especially here in Texas, it's still a local issue. So your municipal water source is who makes the final decision on whether fluoride is in your water or not. And you can always go, there's a website, I think it's EWG, where you can look up your water supply by zip code, and it will tell you, what all is found in the water. You can find if they add fluoride or not. Interestingly, one of the wealthiest communities in the country, in our area, Highland Park, University Park, does not have fluoride in their water, but Dallas does, Richardson does. The other larger communities do fluoride. Yeah.
Hence the need for water filtration, which is a whole other conversation too.
Yeah.
So last time I was in, you guys introduced the bristle test to me. That was new. And for those that haven't done it, literally I just spit into a vial and you send it off.
Yeah.
And then I had a conversation with one of your associates, and she said I had the worst score she had ever.
Oh my gosh.
And I was shocked, right? Because I am very good with oral care. I feel like I'm pretty good in terms of everything else. So I am working through that.
Good. You got you on the protocol.
Yeah, right. Which I'm glad I did it. I'm always wanting to learn more about my health and so many different facets. So I appreciate you guys offering that. So for those that don't know, what is it? What does it test for? Give us the skinny behind it.
Yeah. So saliva testing has been around for a while. One that I used, a decade or so ago was from a company called Oral DNA, and they're still around and they do a fantastic job. But these companies learned how to look at DNA signatures of certain bacteria. They're not looking at your DNA signatures of bacteria. And then Bristle came along with different testing methods, and they're actually able to test for not just pathogens. Oral DNA was just looking at 7 or 8 of these pathogenic bacteria that were most closely associated with different health impacts. Now, Bristle is able to actually look for all of the above, over 700 different species of bacteria, fungi, that sort of thing, so that you can see what bad bacteria are in there, what good bacteria are in there. Do you have enough of the good stuff? Do you have enough bacteria that can produce nitric oxide for you that protects your heart health? Do you have any bacteria that are closely associated with gut issues? And so we can see those correlations too. So it really gives us a ton of information to where we can be really specific and personalized with your care.
Mm-hmm.
So we can do that. You don't have clinical disease issues, so we're not looking for anything to do in the office necessarily. But some people are. Like some people are in middle to later stages of gum disease. We need to know that, because there are certain treatment methods that will work better with some bacteria than others.
So you would hope that all of your patients do it just to give you more information in terms of how you, okay.
For sure.
Approach it. Yeah, I was blown away. So I'm working on that. I'm going to become now one of your better candidates.
I love it.
Okay, so mouth breathing, I feel like never ever had been talked about until maybe over the last 5 years. I'm sure it's been very in your world. But all of a sudden mouth breathing and mouth taping and such. So what does mouth breathing cause? What is the problem behind the mouth breathing?
Well, you heard me just mention nitric oxide. That's a huge piece of it. You are more effectively able to produce nitric oxide from your nose than from your mouth.
Okay.
So if you are nasal breathing, then you will absolutely be able to produce more nitric oxide, produce the appropriate amounts of nitric oxide than if you're breathing through your mouth. Breathing through your mouth is just less efficient. You can't produce nitric oxide. You can't filter the air appropriately. And not only that, it provides the opportunity for the tongue to fall back in the back of the throat and makes you more likely to have breathing issues like obstructive sleep apnea. It can, over time, especially when we're talking about our kids, it can actually change the shape of their mouth, change the shape of their jaw, and cause a restricted airway. Mouth breathing as a child, especially during those big growth phases, can actually set them up for an adulthood of sleep apnea and snoring and poor breathing.
So what do you suggest then? What do you do for kids that mouth breathe? I mean, are you going to tape them up also?
It's funny. The most aggressive one with this, and of course it's our own people, was the first hygienist that I had, who's since retired. But I don't know if you remember Erica. Sweet girl, but she started mouth taping her 5-year-old because she knew it was an issue. And
right. Is there something wrong if they're breathing through their nose? I mean,
as long as so what I will say, so I would test it for anybody. This is a kid or an adult. Test it in the daytime first, because you want to see, are you actually physically able to breathe through your nose? That's important first. You don't want to suffocate anybody. So if you're able to breathe through your nose, try to leave it on for 5 or 10 minutes during the day when you're awake. Make sure it doesn't make you panic or anything like that. And then if you're able to, then start slow, wear it at night, see if you can keep it on for at least an hour at night, and then kind of work your way up from there.
Okay.
Most people, even those who get a little claustrophobic, who get a little bit anxious doing mouth taping at first, usually they're able to work their way into it. And then once you are able to wear it all night or even part of the night, you actually sleep way, way better. So it's a great tool as long as anatomically things are okay.
Yeah.
Now, obviously we want to dig into root cause issues, see what's going on, why the habit developed of mouth breathing in the first place, if there's, nasal work that needs to be done or a tongue tie that needs to be corrected. We need to look for those things. But yes, if we're just talking about the habit that we need to break, mouth taping can help you sleep so much better.
I totally agree. I do. The cedar has been really affecting me lately. So I have not been able to mouth tape because I would not be able to breathe.
Yeah.
But I do notice a big difference in terms of my sleeping.
Yep.
Okay. Prevention then. Let's move on to what would be your top 3, 5 suggestions in terms of cavity prevention.
Cavity prevention. I really think that if we're not going to use fluoride as a tool, we want to be really intentional with the tools that we do use. And so the best way to do that is with a remineralizing toothpaste.
Yep.
And I really like the ingredient calcium hydroxyapatite. You heard me mention it before. It is literally what our enamel is made out of, is calcium hydroxyapatite. And we can get it either in manufactured form, or it's all manufactured, but we can get it in either synthetic form or animal-based hydroxyapatite. Both forms work well. There are different size particles. That's always up for debate, but calcium hydroxyapatite as an ingredient in toothpaste works really, really well at helping to prevent cavities and helping to remineralize those early stage cavities that are just beginning to form. We can catch them while they're early and help stop the process.
Okay.
Another tool that I want all of my patients to use if they are cavity prone, if they are at high risk for cavities, is I want them to use therapeutic amounts of xylitol.
Yes.
Xylitol is a plant-based sweetener. It, again, completely natural, comes from plants. I like to be careful with how we source it, because if you're getting your xylitol just from gum that you get at Target or Walmart, then a lot of that xylitol is corn-based, and corn in the US is usually going to be genetically modified. So that's not ideal. Ideally, you're finding stuff, from the health food store, or you're looking to see that the xylitol is from birch trees instead of from corn.
Okay.
So birch trees is a little cleaner source.
That you just said that, because somebody brought up xylitol recently and they're like, we don't want our kids to have it from like peanut butter or something. And it hadn't even registered in my head. Why would xylitol be? Because I'm thinking they're like, oh no, it's good for you. So right. I'm glad you brought up that point of there are different types and what to look for. So, okay. So the remineralizing toothpaste, xylitol.
Mm-hmm. And the xylitol needs to be done. You need exposure 5 times a day.
That's what you'd say. How do you do that?
It's going to be in your remineralizing toothpaste.
Oh,
so as long as you're getting a high quality toothpaste, then it will be in there as well. And then that gets you 2 exposures a day. Okay. So if you find gum or mint or candy that you like that has xylitol in it, then just do that after each meal. And you've got your 5 exposures super easy.
One of the ones I got from you, it literally tastes like a red hot. So it brings me back to my kid days.
Ooh.
I love them. Okay. So xylitol, remineralizing, is there what other thing you're like, please, please, please make sure you do this besides obviously brushing your teeth twice a day?
Diet.
Yes.
Okay. So eliminating the low-hanging fruit. If it is just really hard to stop from getting cavities if you've got a soda habit. So the easy stuff that just makes sense. Yeah. If you're letting sugary substances sit on your teeth for a long period of time, then that is going to feed the cavity causing bacteria and create an acidic environment in the mouth. And it's the acid itself that's wearing away at the enamel. So that's hugely important to avoid the foods that we know that just make sense that they're trouble. but also making sure that we get the nutrients that we need and that we're able to absorb them properly. So I really want, diet-wise, I want everybody to focus on making sure that you get enough healthy protein and enough healthy fats. So most of the nutrients that your teeth need are fat-soluble vitamins and minerals. So your avocados, your olive oils, high-quality animal fats if you're eating animals, we've got plenty of vegan and vegetarian patients. I understand that there are religious and ethical reasons to be plant-based and to not consume animals for food. But I will say, if you don't have one of those religious or ethical constraints around your diet, we've got to have you eating meat. I think it should be sourced really well, ethically sourced. Look for your pasture-raised beef, look for your free-range chicken. But eating animals that lived a decent life is really the easiest way to get the nutrients that you need for a healthy mouth and a healthy gut.
I love that you're talking about that. Like, the food aspect is huge in all aspects of our life, but I love that connection, because I don't think people make the connection between a healthy gut and a healthy mouth.
Yeah, your mouth is your gut.
I never thought about that until obviously starting working with you, but it's so interesting. Okay, so red wine, how bad is it? Let's get down to the skinny here.
Let's get down to it. I mean, it does tend to stain the teeth in a very special way. It's a little bit acidic, so you actually don't want to brush right away.
Okay.
After you've had something acidic to drink, you want to give the pH in your mouth a little bit of time to buffer and come back to relatively neutral before you go scrubbing with a toothbrush. Same thing with mouthwash. Mouthwashes can sometimes be really acidic, so you want to make sure, depending, not the ones that are at my office, don't you worry, but like the stuff in a bright green bottle or a bright blue bottle, that stuff is just as acidic as soda. So you have to be careful with that.
Literally, that is next on my list, is mouthwash. Do we do it? Do we not do it? I'll say, from doing the bristle test, that's part of my protocol. And I am using the food grade hydrogen peroxide.
Awesome.
So I'm doing that twice a day now,
but not for forever, right?
Not for forever.
That's the thing. So sometimes we're thinking of your mouth kind of like a garden. And sometimes we just need to pick a few weeds. And that's all. And so,
love that analogy. That's awesome.
Let's keep it really gentle.
Yes.
And then sometimes there are some bacterial strains that are associated with some bad mamma jamma stuff. So if you've got this like Porphyromonas gingivalis and you're trying to get pregnant, I want that stuff killed like ASAP. And so I may take a blowtorch to things. Like, we're going to, if we need Roundup for the mouth, we're going to do it, but for a very specific limited amount of time. Okay. So sometimes we need to kill things, but then we're going to keep it short and sweet. And then we're going to repopulate with the good bacteria then as fast as we can after that phase is done. And for you, in your instance, if we're doing hydrogen peroxide, that means that the bad bacteria that was in there, they are all anaerobic or oxygen-hating bacteria. So the hydrogen peroxide will give your mouth this boost of oxygen where those bacteria can't thrive. So we're going to kill some stuff, but then we're going to go back later and do some really targeted probiotics. It's a gentle blowtorch. A gentle blowtorch in your case. I don't like, even when we're needing to get hard and heavy with the antimicrobials, I no longer use the stuff that's bright blue or bright green in the big box stores.
So just a big no to that.
It's just a big no. Yeah.
But I'm because I feel like what you're saying in terms of mouthwash is that there's a time and a place for it, but it's not something that everybody should be doing on the daily. And we're talking about clean mouthwash here, not the colored Okay. So
Correct.
really ultimately you should be doing the bristle test first to determine your needs and to see if that should be part of your protocol or not.
Absolutely.
I love it. Okay. I think that's very interesting. I feel like there's a lot of people that are using mouthwash out there on a daily.
Yeah. Oh, I was a hardcore Listerine addict for years and years.
Oh yeah. And then toothpaste, I know you mentioned what to look for, the ingredient that you prefer. I know that we use Risewell or Boca. Are there any others that you would recommend?
We're really fortunate. And in the last few years, there have been quite a few brands who have come out that have clean ingredients. They don't have a ton of junk in them, but they've got those specific ingredients that can be beneficial. So those are two of my favorite, and they stay patient favorites. Risewell, it has just been a really good partner for us, because I know toothpaste gets controversial for some reason in the crunchy holistic world. So people get all up in arms about some kind of ingredient or something with toothpaste. I can actually call the founders on the phone and get an answer.
Oh, I love it.
From Risewell. So I think they'll be my ride or die forever.
Okay.
Because they have really good transparency and I trust them.
Which is huge. And the beauty that you can call and get a direct answer from them, because I know, yes, in that space, a lot of people are reaching out to the manufacturers or the companies. I want more detail. I want this. And it's a blanket statement, so you never are, you're unsure. Do I trust them? Do not? So that's wonderful to hear that. Toothbrushes, soft.
Always soft.
Always soft. Electric.
I prefer electric.
And now I'm seeing the red light toothbrushes. Yay, nay?
I've seen some of these. I haven't used enough to know who's perfected it yet and who hasn't. So in concept, it's a great idea. It might be faster, more efficient to do one of the little red light trays.
Okay.
They make for whitening. I think we're just in the beginning of this red light revolution that we're having. So there's all kinds of stuff out there. And I think it's still to be determined what's the best.
Okay. Because I had just started singing. I'm like, I have to ask Dr. Toni if that's something I need to invest in. So I'll hold off in terms of that. Tongue scraping. Do you recommend that for everybody?
Yes, I love it.
Twice a day. What's the protocol there?
I think once a day is fine.
Once a day is good. Okay. Yeah. And then flossing once a day, evening time.
Ideally. I'm very much a realist when it comes to flossing. So if you want to know what's correct and what's specifically correct and most supported in the literature, then my hygienist will tell you what's correct and most supported in the literature. And that is, making sure you use the string and do the C shape around every spot. And it's, at least once a day, either before or after you brush. And there's debate around that. I'm just happy if you get something in between your teeth.
Yeah, because they do say nighttime, and I will say it happens in the morning for me. Nighttime, I'm quickly brushing and I'm out. But
I totally get it. Yeah.
Okay, so one more thing is just curious if there's something we have not discussed today that you're like, Meg, everybody needs to know about this, or it's very eye-opening. Is there anything that we haven't touched on that you're like, really, your listeners would enjoy hearing this?
I mean, we talked a little bit about root canals. So I would say really just knowing that there are connections, and not just root canals, for anything. I love taking a more integrative Eastern and Western medicine approach to looking at oral health care. And so anybody can go online and just look up a tooth meridian chart, and you can see where in Eastern medicine, how is each single tooth connected to the rest of the body? And so we'll use that a lot of times as an adjunct to our diagnostic methods. Diagnostic imaging gets better and better every year. And so we're able to see a lot, but even as much as we're able to see, it doesn't always give us the right answers. And so we can use some of these more integrated, these older Eastern medicine methods and use it to help guide our decision making when we don't have clear answers from an objective sense. So I highly recommend everybody look up a tooth meridian chart. That's why, honestly, that's why a lot of patients will come to me is they will have some kind of diagnosis. Maybe it's a breast cancer, maybe it's something else. They'll have a diagnosis and they'll say, I've been working with my holistic doctor or my functional medicine doctor. I have a root canal on an upper molar and I know it's connected to my breast.
Oh, wow.
And so then we get to have the conversation and kind of go from there.
Wow. That's interesting.
Mm-hmm.
I love to hear what you guys kind of do behind the scenes in terms of the chart. So, you're approaching, everybody's needs based on stuff like that. So it's cool to hear that as my doctor, all that you guys are doing. I end it with always one unapologetic tip. So it's really doesn't have to have anything to do with oral care, but just something that you think has an impact on people's lives, whether it's health or wellness, or what could you leave us with?
I would say the best advice that I can give is that your bodies are actually designed to heal. So don't let anybody, don't let anyone, no doctor, no professional, no family member tell you that it's not possible. We're designed to heal. We just have to give the body what it needs.
Love it. And coming from someone that has. So I appreciate it, Dr. Toni. Thank you so much.
Thank you so much. I appreciate it.
Yeah, I appreciate it. Bye, Dr. Toni.
Alrighty, bye.
Thanks for tuning in to Unapologetically Meg. If this episode resonated with you, we'd love for you to share it with someone who's ready to live cleaner, bolder, and more intentionally. You can follow Meg on Instagram, TikTok, and YouTube at Organically Meg. And don't forget to check the show notes for links, resources, and other ways to stay connected. Until next time, stay well, stay unapologetic, and remember, it's not about perfect, it's about better.